Addressing mental health disparities. Marginalized communities often face significant barriers to mental health care, including stigma, financial limitations, and lack of access to resources. Addressing these disparities requires a combination of policy changes, community-based programs, and culturally competent care to ensure that mental well-being is a priority for all. Reducing stigma around mental health. Many marginalized groups experience cultural stigma surrounding mental health issues, preventing individuals from seeking help. Community leaders, educators, and healthcare professionals can play a crucial role in breaking down these barriers through education, open discussions, and mental health advocacy. Expanding access to affordable mental health services. High costs and lack of insurance coverage prevent many individuals in marginalized communities from receiving necessary mental health care. Expanding government-funded programs, community clinics, and telehealth services can make therapy and counseling more accessible to those in need. Culturally competent mental health support. Traditional mental health care models may not always address the specific needs of diverse populations. Training mental health professionals to understand cultural backgrounds, language barriers, and unique challenges faced by marginalized groups can improve the effectiveness of treatment. Building strong community support systems. Social support is a key factor in mental well-being. Establishing local support groups, peer mentorship programs, and community outreach initiatives can create safe spaces where individuals feel heard and supported in their struggles. Leveraging technology for mental health resources. Digital mental health tools, such as apps, online therapy platforms, and virtual support groups, can bridge the gap for communities with limited in-person mental health services. These platforms provide confidential, low-cost, and accessible ways for individuals to seek help. Addressing social determinants of mental health. Factors such as poverty, discrimination, and unstable housing contribute to mental health struggles. Addressing these systemic issues through policy reform, economic support programs, and social justice initiatives can improve overall mental well-being in marginalized communities. Mental health education in schools and workplaces. Integrating mental health awareness into school curricula and workplace policies can create early intervention opportunities. Teaching emotional resilience, stress management, and coping strategies helps individuals build long-term mental wellness habits. Encouraging holistic and traditional healing practices. Many marginalized communities have deep-rooted healing traditions that emphasize spiritual and holistic well-being. Recognizing and incorporating these practices alongside modern therapy can make mental health care more culturally inclusive and effective. Advocating for mental health policy reform. Systemic change is necessary to ensure long-term mental health improvements. Supporting policies that increase mental health funding, expand community-based care, and protect marginalized individuals from discrimination can create a more equitable mental health system for all.